The history of blast-induced TBI is a long, long one. You go back to World War I and World War II, and we're all familiar with the term shell shock and things along those lines. But since human beings have been blowing each other up, which is about 100 and some odd years now, there's been some recognition that the blast wave potentially may affect the brain. It's interesting, coming up into this conflict, there still was no research done in that area whatsoever. And there was a tremendous number of questions early on was regarding the primary blast wave, so the actual overpressure and underpressure wave that comes through. Could that actually affect the brain? Did it have enough ability to actually produce a trauma to produce an injury to the brain into a concussion? So fortunately, over the last I guess we're at about 10 years here now, or more so. There's been a large number of studies out there, animal models, but then also looking at human beings who have been through it. It does seem that a blast wave is capable of causing a traumatic brain injury, a concussion. Really not much more than that, though. When you start to look at the other complexities of a blast wave, it's not just a blast wave goes through, but you also may be hit by a radiator or an air conditioner, or you may be thrown 50 feet against a wall, and those can cause some more severe types of traumatic brain injury with intracranial bleeding and the other things that we're accustomed to. But the blast wave itself definitely appears able to cause a concussion. Fortunately, it looks like the recovery courses from blast-induced mild traumatic brain injury are going to be very similar to sports-related or civilian-based mild traumatic brain injury as well. So and there isn't a lot of research in this area, but it's gaining relatively quickly. And it does appear that a blast TBI is very similar as an isolated event to an individual who suffers a sports-related concussion or motor vehicle-related, whereas the majority of people get better, and there's a smaller percentage of those who don't. There's a huge difference, though, in terms of the context of the injury. If you're injured on a football field, which can be devastating, a concussion can be devastating, as we know, in that area. But after the concussion, people aren't trying to kill you. People aren't shooting at you, right? You're not seeing your loved ones, your brothers, be maimed and killed in front of you. You're not then pressed out the next day to go back out and to do it again and again and again. So when you look at the combat stress syndromes, I think people miss a big piece of them. And they see the combat stress syndromes as the isolated, stressful event that happened and the things that happened thereafter. But realistically speaking, if you talk about a Marine who's on a 6 or a 12-month deployment and who's outside the wire on a daily basis, their brains get rewired for the ability to actually be that vigilant, the ability to constantly assess the risk that's around them and to respond to that. Individuals' brains change to the point where driving down a busy street in Iraq in an up-armored Humvee on top of a 50mm machine gun, after a while that feels normal. But unfortunately, when you come back, it doesn't feel normal to go to Walmart anymore because you're still doing the risk assessment piece. So whereas we started talking about initially, the blast definitely seems like it can cause a mild traumatic brain injury or concussion. The prolonged exposure to significant physical danger and harm and the ability for the human mind to actually adapt to that is amazing. But unfortunately, it looks like the human mind and the brain don't turn it off very well and then carry that forward as individuals come back. And if there are people out there who are watching this, please get help. Please know that you're not the only one out there who's dealing with this. There are literally thousands of other individuals just like yourself. There is help available at your local VA. Please contact the OEF, OIF team there, and they will get you plugged in for care.